Ontario Community Health Services Diabetes Education Program. Today we're going to talk about low blood sugars, also known as hypoglycemia. So low blood sugars or hypoglycemia can happen when we're more physically active than usual, or we're not eating on time, sometimes we've missed a meal, or can even be caused by too much medication. Okay? So one of the things that some people say is they feel shaky, lightheaded, very, very hungry, sweaty, drowsy. Some people even feel a little bit nauseous. Have you ever had feelings like this?
I have to say I have, and I guess I want to know why should I be concerned about a low blood sugar should that happen?
It's a great question. So low blood sugars, when our blood sugar goes below 4.0, it can cause confusion, disorientation. People could even lose consciousness or have a fall.
Well, I know I don't want to have a fall, I don't want to break a hip, and I certainly don't want to end up in the hospital unnecessarily.
Absolutely. So one of our goals with reducing low blood sugars is to prevent unnecessary hospitalizations and injuries. So something that's really important is to make sure that if you're ever feeling unwell, not feeling like yourself, we want to test our blood sugar. Okay, so you can use your blood glucose meter to test your blood sugar. You're going to do a little finger prick, put your drop on the end, you're going to wait for the reading. If the reading on your meter says anything below 4.0,
well, what about something like just slightly below, like a 3.9? Is that too low?
Even a 3.9 is too low.
Okay, so that would be a time that I should maybe go ahead and start eating then?
We actually don't want to have a snack right away. What we want to do is use a fast-acting sugar to help increase our blood sugar faster. If we eat food, it has to take time to digest, and that's not going to bring our blood sugar up fast enough. So in those circumstances, if you do have a blood sugar below 4.0, we're going to want to use some fast-acting sugar to bring our glucose up. Okay? So that could be a juice box.
It could be type of juice?
Any type of juice. Okay? As long as it has 15 grams of carbohydrate or sugar in it. Your other option, if you don't have a juice box at home, would be any type of juice in the fridge, about 2/3 of a cup. If you don't have juice or a juice box, sugar packets, 1 tablespoon or 3 packets, or a tablespoon of honey or a tablespoon of maple syrup, or other options that you could use.
So I certainly have some of those in the house, but it would be really hard for me to try to carry juice or sugar packages. What could I do when I'm out?
So if you're out and about and you're not at home, one of the things we suggest are sugar pills or little sugar tablets. And you can get them at the pharmacy, and they come in a little tube. And we would want you to take 4 of those sugar tablets. I'm going to show you what they look like. So inside the tube are going to be these little sugar tablets, okay? We actually, as a treatment for hypoglycemia, need 4 of these.
Not 1?
Not 1, 4.
Not 2?
Not 2.
So
4.
Okay.
I'm Jack the Parrot. I'm helping my friends at Reno Community Health Services Diabetes Education Program. If your blood sugar is below 4, take 4 Dex4, 4 Dex4, not 1, not 2, not 3, 4 Dex4, 4 Dex4.
Okay.
So 4 sugar tablets is going to equal the same amount of fast-acting sugar as a juice box, your 2/3 of a cup of juice, or your tablespoon of sugar. That's all.
Okay.
You can chew them and take them with water. They're not dissolvable. You do have to be able to chew them. Okay, so those are all options for treating a low blood sugar. After you treat your low, you want to wait 10 to 15 minutes and recheck your blood sugar. Okay, it's really important that we make sure that it gets up above that 4.0. If it's not above 4 after 10 to 15 minutes, we need to treat again with any of those options.
And then do I need to wait another 10, 15 minutes?
You sure do.
Okay.
So after 10 to 15 minutes of your first treatment, or if that didn't work, your second treatment, once your blood sugar is up above 4.0, we want to have a snack. Okay, that's when we're going to eat.
So could I eat something like a piece of bread and peanut butter?
Absolutely.
Okay.
We want to have a little bit of carbohydrate and a little bit of protein. So that could be bread and peanut butter, or it could be fruit and nuts. Okay, those are both really great options that are going to help sustain your blood sugar and prevent you from having a low later on.
But that's only once I treat it, wait 10, 15 minutes, get my sugar above 4, then go ahead and eat. Okay.
Exactly. Okay, you're going to want to make sure you monitor a little bit more through the day, that day that you've had a low, and try and figure out why you're having low blood sugars. If you're seeing it as a pattern, it's a time to talk to your doctor or your diabetes educator.
Okay, that makes sense. Thank you.
You're welcome.